lot of people think if I take IVs, injection, drip, then I go well quick.
Yeah.
Whenever you visit the pharmacy, allow the professional.
Just
Just looking at your state.
The health professional knows best. And it may not even be in the pharmacy. It may be at the hospital. People go there and say, "Doctor, I get malaria."
I get malaria.
Yes, I get malaria.
In Sierra Leone especially, we love sympathy.
Yeah.
So a lot of people think if I tell you I'm not well,
Oh,
if I tell you I'm
they
not
use
well,
that. They take
and you don't,
pictures.
yes, you don't see you don't see me taking
The
my oral
severity of the
medication.
condition.
Yeah.
I've seen people even with
Okay.
the orals,
Yes.
they put a lot of tablets.
I have seen those
and
pictures.
for the gram.
No, it goes more with the IVs.
I remember
Yes,
I
there's-
was in encounter with
Most of
someone. He had some condition and I prescribed some medicine and he was saying, no injection. And I was like, you don't need injection.
Health education is very poor. Like, people just have a particular kind of mentality.
Do you think we are making more money if we give that injection? Hello, healthy fams. How are you? I am Fam Diane. And as you know, we have been going on with the health discussions. If this is your first time here, please go back and follow the YouTube channel, the Instagram, and the Facebook. Please like, subscribe, and comment because we need those to give feedback for us. Always, I have here with me my beautiful ladies. You know, you're looking good, oh. You're looking sweet.
Thank you.
You're looking sweet. And
As always, I'm from Nasu. Happy to be here.
Yes, as you know, I'm from Joan. Good to see you again.
Hello, family. I'm from Jacinta. Also happy to meet with you guys again on the screen.
Hello, I'm from Fieldis. I'm glad to be here and welcome if you are new here.
Fan Phyllis, you are looking sharp.
Thank you.
How do you maintain a healthy mind on a Monday morning?
Oh, wow. I think,
On a Monday morning,
I think it
rush
all
hour.
depends on your
MMM.
weekend, right?
Yeah.
Yeah.
Your weekend. How
Proper
much-
prior planning.
Yes.
Yes.
I love that.
Get enough rest.
Yeah.
If you can have some exercise.
Yes.
On Saturday, you mean?
Exercise.
Vigorous exercise.
Yeah, vigorous exercise.
What do you mean?
There are a lot of different exercises anyway.
Okay.
Uh-huh.
And I think having a good exercise,
Good exercise.
if you know what I mean.
Yeah.
And even proper planning helps a
Yeah.
lot.
Eat well.
Yeah.
Eat well.
It's healthy.
Mhm.
Healthy.
Eating well is not the same as eating too
healthy.
much.
Yeah.
Okay.
Yeah,
A healthy, balanced diet.
exactly.
We know we have the Saturday weddings.
Okay,
Mhm.
so
we have the Saturday weddings.
so there's this Sunday secret
Mhm.
that you use, and I've been implementing it, and it makes my Monday a little less stressful.
Really?
Okay.
Yeah. So between the hours of 5 to 7, I use it to think, rest, and plan my day, my
Mhm,
Monday.
mhm.
I'm very intentional about Monday because the
Yeah.
start of the week,
Yeah, it's very important.
it makes the
it helps
the
with your
rest of the week.
production, yeah, for the week.
So so between the hours of 5 to 7,
Hmm.
I have a me time
Okay.
wherein I refill my energy.
Where are the babies?
No.
I said I have a me time.
Oh, okay.
You can
Thank
shut
you.
the door.
They shut the door.
Yeah, I
Okay.
think that is even good, especially for us that have kids.
Yeah.
The me time is very important.
Your week or even your
Mhm.
Monday
Yeah.
goes a lot.
Yeah.
Oh yeah.
Because
Yeah.
waking up in the morning, you try to settle the kids, especially school is starting soon
Yeah.
Mhm.
or they are in school,
Mhm.
you know.
You know
So
that
I think it's been more intentional
Yeah.
about
Yeah.
because
your
the outcome of the
routine.
Monday determines the rest,
of the week. Yeah,
the
sure.
outcome of the Monday.
Very true.
For today, we are discussing the prevalence of IVs over orals. I know IVs might be a bit new to all of us, but injections, you love injections. Normally, when you come to us for medication, you prefer the injections and you will say, "Nine fits me." I don't hear Boku, 9 fits me.
Mm.
You know, there was a day I did a shop and at the time for sale, and I did tell the person, say, okay, you can take the anti-malaria,
Ah.
you know. No, the anti-malaria oral. And he said, no, it wants injection. You know, you love injections, and we have observed for a long time that you prefer injections over oral. Probably you don't know much about it. So we're here today to discuss, and, you know, first let's share our experience. What do you know? What have you experienced so far with this?
I think all of us have one or two experiences. with
Exactly,
that.
because we've all been in the community.
Yeah, I've all
Yeah.
worked in community pharmacy.
Even with our families.
Yeah.
Even with our families.
Exactly.
Yes,
True.
who says, yeah, with the family.
People that are
So I have
close
this
to us.
family member. There was a time that she was sick. I bought some oral medications. Huge sum of money. I was expecting this person to take. And
your money wasted.
yeah, it got wasted. She told me, no. Pass you, give me injection. In fact, the actual word was, pass I take drip
Oh my
before I go
goodness.
well. So I think it's about the psyche.
Yeah.
A lot of people think if I take IVs, injection, drip, then I go well quick.
Yeah.
I think it's about the psyche.
So normally the psych, I ask a lot of questions, and sometimes it can be frustrating because you go to talk, the person don't insist, they don't make up in mind. Now I realize say they don't get experience before and it look work for them. So the switch to the oral can be very difficult. How I can handle them? Because most of the time, some of them patients they then just need oral tablets
Yeah.
Oh,
to
yeah.
help them. So how I can manage the situation then they on a daily?
I think it's part of what we've talked about in the beginning. It's part of the pharmacist's job
Yeah.
to educate the patients,
So,
to tell them about what their medication is, what it does to their body,
Yeah.
how it works, and to tell them the benefits.
Yeah.
So when you do this, you increase compliance from the patient's side. Yes, and when they understand what they are taking, what is it about, they will know, I mean, the level of importance and care
Yeah.
to put into that kind of thing.
You know, we are not debunking the importance of IVs. They are important because
yeah.
the routes of administration.
yeah.
We were
yeah.
taught that for a
Sure.
reason so that we know when and how to give them. So it's very important.
Yeah.
But what are the factors we should be looking out for to give? You know, there are factors, there are things we should consider before giving IVs.
So I think the severity is very important because let's say someone comes to you vomiting, you can't recommend an oral
That's a
medication.
factor I always
Yeah.
look out for.
So you look
if you're
out for
vomiting.
necessity when it's necessary.
And vomiting like means say if you take you don't
You get to pull am
you don't
back.
pull them back.
You get to
That
pull
means
am
medicine not again for make you well.
Yeah.
So, another thing again, because we all know the first point of contact as far as setting of any patient is the community pharmacy.
Most of the time.
So, we are using this platform to let our patients know. Whenever you visit the pharmacy, allow the professional. Just looking at your state,
Yeah.
you know, your well-being documents, that professional will be able to prefer
Yeah.
a better route of administration.
True.
We honestly, IVs are only, given to patients that are stable as
Yeah.
So you not visit the pharmacy. Imagine, like you work account.
Yeah.
That's why you don't tell me say you condition that complicated. For example, say you work account.
You work account.
You work account.
You are breathing
Able to-
fine.
You talk.
Yeah.
But it's not fun to some extent.
Yeah.
Someone coming to your pharmacy and telling you studying at commerce for 7 years. And somebody
You have to
comes in
introduce
Yeah.
it.
I think it cuts
or 8
across.
years ago,
Yeah.
telling you now this line fits me.
Mm.
Now this me go one.
And educated people do that also, so it's not limited.
Oh, yeah.
Yes,
And the
of
sad
course.
part is, if you don't give them what they request for, they take it. They take
They go
their
for
yeah.
Someone
So-
take it personal.
I think it's very important that we are doing this podcast. So we tell people that, the health professional knows best. And it may not even be in the pharmacy. It may be at the hospital. People go there and say, doctor, I get malaria.
I get malaria.
Yes.
Yes, I get malaria type.
And
I'd give her
do you
40.
know most of the time also when they know you are hesitant to give, they just buy and they take it away to take.
So that brings us to adherence of to medications. A lot of times, I think why these people will want to take IVs or IMs, it's cut across with the adherence. A lot of times when you tell the patient, take these tablets every 8 hours, every 6 hours, for some of them, it's so much of a burden on them that they don't want to be reminded to take.
Can we count that
Tablets.
as another factor for giving IVs? Because if, for instance, you are treating for malaria and they have to take, the first dose is 8 hours interval,
Yes.
the second is 12, right?
Yes.
So if the patient, the patient is not consistent with that, would not be consistent,
So
would you tweak on your idea of giving
no,
the
for
orals?
me,
Okay.
for me, I think we discussed on that issue. We are not just there to dispense.
Mhm.
We counsel the patient and we keep in touch with our patients. So what you do, there are times that there was one whatnot that we use, that we keep a reminder. For some patients that come to me, I do a reminder with their phones.
Okay. Oh, great.
Yes.
Great.
Or take their contact and call them.
Perfect.
Okay.
So
then that
it has
Yeah.
to be with the
Okay.
relationship you have with the patient.
yeah, your customer.
Some people, you ask them, do you forget to take your medications? And they say, no, I don't forget. Or
Oh.
some people, they tell you, oh, my child reminds me to take my medication.
Okay.
For people that are on long-term medications, like the antihypertensives,
Yeah.
they some tell you, oh, me grandpikin na iki remember me every day. Granny, you don't take your medicine.
You know,
So for those people, they already have a human
routine, yeah.
reminder.
Yeah.
But to be in touch and to ensure that they take their medicines as per required time, you have to really keep in touch. Take their contacts, do a reminder in their phones, and just
My concern is for the most time I've seen people not completing their dosage.
Of course.
Even with IMs.
Even with IMs, they will not
Especially
come
those
again.
that come for this treatment for STIs.
Yeah.
As soon as they start feeling better,
They stop.
will not show up.
They
the
stop.
symptoms have been relieved.
They stop. They stop.
I think
Yeah.
we also have another set of people that actually don't like oral medication.
Yes.
Yeah.
There is a set.
I know someone like that.
There is a set.
Yes, and whenever they are sick, they will just call, oh, I don't feel this, I feel unwell, my kids are sick, my wife is sick, and all of that. Please, what do we do? And before you say anything, I don't want oral. So I'm like, well, there you have it. I think first of all, go get checked, and so we know what exactly
And
is
do
wrong.
you also know there are instances where these patients will go out there and say, Adani, no sabi wo."
Yes,
Yes.
yes. They say that.
Medical or forcing
So
on
for
us.
me,
Because
from
of
the
injection.
professional point of view, stand your ground.
Stick to your
Because
principles,
we
yeah.
know what
implications.
yes, not just the implications. The healthcare provider knows the right route of medication to give for any condition.
Yeah.
So if you trust them enough, then follow through with the advice that you're giving. I mean, if you are to take it, because there are some medications, I mean, that are just oral.
You
We
can't
don't
find
have
them
we don't
in
have
that other
everything
form.
in
On-
oral,
yeah, and
IV,
IV.
as a patch,
Yeah.
topical.
Mhm.
Some medications are not like that. Some are just oral, fixed.
Yeah.
Some are IM.
Yes, like the
IVs,
vaccines,
yes.
those vaccines.
So
Yeah.
if you say, me, I not like needle business, and you have to take a vaccine, what would you do?
Do you think it's a bit cost effective for them?
Well, it's not even cost.
They don't mind. Okay.
Yeah, it's
The oral, I think it's even cheaper.
It's even cheaper.
exactly.
Okay, I think it has to do also with behaviors. Most of us, when we want to give our kids medication, we have to have the cane. And it will make them to be afraid of taking orals. So they go with it.
Really? That's
Yes.
a good...
So they go with it. And also, even for people that say, I don't like the needles. It
Yes.
also starts
I don't like
from
the
their their childhood. So some people, when they want to scare these children, especially when you're a health professional,
Yeah.
they go call that auntie for
Doctor,
you.
they can't
And they can't
choke
choke you. So that fear makes the
Yeah.
person not to love it,
Mhm.
even when they are grown up.
Mhm.
So I think if we can just, may we begin bio picking them.
Ye-
Take the Meresia, it will make you well. You see, when you know well, you know they're able to play. Then they'll come to love it and they'll come to appreciate taking orals.
Easier
if
said than done.
Easier said, become my doctor. She would fight.
Sometimes you have to put it in a cup and put it under the watermelon. So they can...
No, we have to do
No,
all
we'll do our-
we can
yeah.
to ensure that when it's necessary. Because there are some people also, they just do it anytime, every time. Some people just like people taking medicines. And a lot of these people are not even privy to what these medications can cause, their side effects, their harmful behaviors. But lest we forget, I think we can tell our audiences
Yes,
about
because
the different
the
routes
different routes.
of
The differences
administration of
between the
drugs.
two, because
So, for example, the orals, they say oral.
oral tablets
It
for
get for do with
drink.
tablets, capsule, anything where you dey swell, where they pass now you mouth.
Where you dey swell
Syrup, nine oral. It be blood tonic now. Anything once you get for pass through you mouth,
you swell
for go na your throat. Then they na oral medication. Then we get the intramuscular. So
Injection.
Those ones you give via the muscle. So intramuscular now where they choke you, now you muscle. It can be any muscle. Sometimes they give on the thigh, sometimes, and the most common one is the buttocks. Sometimes they even give on the deltoid muscle. This one that you and can give you this. So that is IM, and there is IV intravenous where they pass now you vein, you know, most of the time. Where
They
they,
get the sublingual.
yes,
Okay.
that one
Place
they
it
put
on.
under your tongue, sublingual,
Place it.
under the
So
tongue,
topical,
Yeah.
you rub like
on your
cream.
skin.
Or then
Yeah.
you go rub na your skin all day.
Yeah,
You know,
we even get the gases, the
Yeah,
vaporize,
inhalers.
yes,
Aerosols.
inhalers
Yes.
and aerosols.
And
yeah.
also, Pam Diane, we're smart enough.
Manufacturer
So
and
the
the
reason for
right
all of these different routes of administration. You know, there are patients with some kind of health conditions whom you will not advise to take statin.
Exactly.
Yeah.
Exactly.
And also, we know the environment in which we find ourselves. People don't know, say this paracetamol, they even kill you, wait, take a overdose.
Oh yeah.
I've had that scenario
And the
before.
antidote
I
is
have.
not here.
Oh,
Well, pass if you go finance on site. Me, I don't know
Especially
about
when-
you.
And it will be very expensive.
Very
it's
expensive.
not advisable. Our audience should know from henceforth, especially those taking alcohol.
Yeah.
If you take too much of alcohol with paracetamol, you are ending
Even with
your life.
And
Flagyl.
You're going to pack your liver.
Yes.
You put your liver under so much of pressure.
They don't know. They don't know.
Last. And I know more we can.
You know, most of the time in the community pharmacy, I do a lot of talking. And it's as if it's irritating the customer. I talk a lot with them. I just want to have more information so that they can know what they are taking. And, you know, the compliance factor, when they know what they are taking and why they are taking it.
they don't
But
have the time.
they are always uneasy to go. There was this time when the guy, and normally can take her. But by the way, you're not waiting. I say, me na pharmacist. Okay, you're not pharmacist. You know, afterwards. But it's not. In Africa, everybody is in health.
Yes.
I've experienced that with my family. They are always getting their self-medication.
Yes. Oh yes.
So when you talk, but you sent me to school, please help me. Allow me to help you.
Exactly.
So that we avoid certain situations.
Because they will even tell you, this whether person is 90,
Yes.
30.
And
They'll be the
your
one
mom will
teaching you.
even tell you that
Abi, don't
I
do am
I was a
for
doctor
you.
I was a
before you.
I call my mother the doctor at home.
Say Nami menu.
Now me menu.
So
Another reason I think people prefer IVs or irons to orals, in Sierra Leone especially, we love sympathy.
yeah.
So a lot of people think if I tell you I'm not well,
Oh,
if I tell you I'm
they
not
use
well,
that. They
and
take
you don't,
pictures.
yes, you don't see you don't see me taking
The
my oral
severity of the
medications.
condition.
Yeah.
I've seen people even with
Okay.
the orals,
Yes.
they put a lot of tablets.
I have seen those
and take-
pictures.
And take photos.
for the gram.
No, it goes more with the IVs.
Yeah,
The-
yes,
the
but it goes
severity,
more with the IVs.
Adepan drip.
Yeah. So you
In
know,
the patch.
I think we love the sympathy.
Well,
Yeah.
there,
And for-
there are benefits.
And for some people, it comes with financial benefits.
Yes.
Yeah, because when you see, for example, you see some IVs,
Yeah, you know.
me taking an IV.
You know well.
Oh, I'm seriously sick. This lady needs money.
This lady. Why the lady, not a man?
No, mostly it's
will
not
give
with the
the
men.
man?
No,
will give the man?
obviously they go, but who will give the men
Who will give
money?
the
In some other countries, if you are given an IV,
Mm.
means it's a
Very
very
serious
serious condition.
Not in
So,
Sierra
but
Leone.
here,
In Sierra Leone, they will
like
they'll just sit
someone
down.
was telling me about a lady that was sick and she was complaining of stomach problems. She was feeling pain in her stomach, feeling upset, burning sensation. I mean, from that you could tell that you could suspect ulcer, peptic ulcer disease. Yeah, so they took her to the hospital. Before they could do the diagnosis, they have already given her 15 drips, IVs. Yes, and she was looking all puffy, like she was about to blow. So yes, and she was still complaining.
Unethical behaviors of some of our health professionals.
Yeah, but that is a
Well,
topic for another day.
Well,
but
well,
why would you want
even
to give
some of us
someone
were, were
15?
mistaken.
No,
yeah,
They did that to a friend of mine's daughter.
Mhm.
She was so puffy. If you are touching her skin,
like pitting
oh my
edema.
God.
Mm.
So
I have to
these
send
are some of
them
the
to-
issues.
So
pediatrician.
another thing I really want to I want for tell family out there. You see with IVs, in no get shortcut, in the direct na the blood.
Now then they am one end with
You know
for
get
reverse
shortcut.
dandy.
You know,
No,
sometimes
reverse
with orals where you don't drink
Okay.
sometimes if not the wrong one, we
We get
can
away
give
for
you
make you throw
something
up.
where you
System.
go purge, you go vomit or waiting.
You can't get
Then
started with
you
the
go.
pass first before you go
Yes.
inside the work.
But with
IVs, direct.
I will send message to the pa in a direct to the pa in the book. So please, our viewers out there, let's limit the intake of our IVs.
Yeah.
May we take only when it's necessary.
Necessary.
In fact, very necessary. Because if you continue for take them and you dey open a gate na your body,
Yeah.
anything can come inside.
Yeah.
Anything can come inside.
Exposing-
Anything can come inside.
And
And at
you
the end of the day, you end up
And
to
the
spend
procedure to even give that, it should be well, the environment.
aseptic technique.
Yes. So, and
I
the
remember that my
practice of
lecturer.
that, are they doing it well?
I think for even common flu, they need IV.
The I get cold.
Flu,
I get cold.
And they even get a
that you need
medication.
home remedies.
Yeah.
They
You
get
hear
the
someone
medication
telling their kid, you don't begin cough back.
You don't begin
Yeah.
come back.
I
and
forgot
go.
Yanda, let them
Go
go give 3 injections.
It
And
is
even when
so
you said
common.
you don't need it.
And you know, they are-
I remember
Yes,
I had
there's-
one encounter with
Most of them said
someone.
no.
He had some condition and I prescribed some medicine and he was saying, no injection. And I was
Yeah.
like, you don't need injection.
Mhm.
Just go try this.
Mhm.
He said, eh.
Mhm.
He was not satisfied.
And it affects the mind.
yeah.
Exactly.
Because if you are being told that you just need the oral tablet or capsule, then you are insisting that you want IVs.
So for me, I think the bottom line is there's a lot of medical or health illiteracy. It's not just the book learning way small
yeah.
as an
Education is
health
important.
education is very poor. Like people just have a particular kind of mentality because of past experiences, because of patterns they've seen
Yeah,
with
yeah,
others,
yeah.
and maybe some small experiences they've had with themselves.
Just
So,
a nudge. Do you think we are making more money if we give that injection?
well, for me,
Mm.
I remember
Mm.
our oath,
Say-
the oath we took
okay.
when
you
we
remember
were being
the oath.
sworn in
Of
as
course,
pharmacists
of course.
and as Christians, and to be morally right.
yeah.
I think it is better
Yeah.
to
You never
do
know
to-
you are treating your family.
Exactly.
You are treating your family.
Yes,
Someone who
and-
will benefit you.
Exactly. What if that person you are saying, well, this are just
These
make
are
money
just-
quick.
Yeah.
That person might be your child's or even your own
Your
destiny
own,
helper
yeah,
in the
yeah,
And there are
future.
some
Yeah.
conditions.
And this
all
is-
people need is just
Yeah.
enough water and rest.
And rest.
Yes, and this is how we
And the rest.
this too much over
Agree.
treatment, over medication, requesting for things that are not there, and we have
It's
people
causing
giving
more
it to them.
problem.
This is what is causing even the antimicrobial resistance
Yes.
that we are having. A lot of
Thank
other
you very
things.
much, Joanne.
So
Thank you
it's
very
a
much,
lot.
my ladies. I know it is very interesting because I'm even learning a lot from what we are
yeah,
discussing here. So viewers, please, follow. Pick out the important things that you need to change about how you practice, how you take your medications. And please don't forget to like, comment, subscribe, and continue to follow us. We're looking and watching for what we are expecting you to do. Thank
and
you.
please listen to your healthcare provider.
Listen to your healthcare providers. Oh,
seek
we're
genuine healthcare providers.
Ah, thank you.
Like
Thank you very
Abu
much.
Quack, you no go pay. Oh.
You know, go pay.
Thank you so
Thank
much.
you.
See you next time.